Hi dear KGR readers, I'm Yitong from Fuwai Hospital. It's my great pleasure and honor to introduce my paper. In this study, we want to provide an automatic method for segmentation and diameter measurement of type B aortic dissection, simply TBAD for short. We implemented a deep learning algorithm to segment and measure. As stated in the 2014 European Society of Cardiology guidelines, multiplanar reformation images based on CT play the central role in confirming diagnosis, risk stratification, and prognosis assessment of aortic dissection. At present, the vascular diameter on CT images is measured manually, which is subjective, time-consuming, and introduce inter- and intra-observer variations. Medical image processing with the help of artificial intelligence may lead to automated measurement without these limitations. Recently, a serial multitask convolutional neural network model has provided accurate and efficient segmentation of TBADs. However, automated measurement of the aortic diameter has not been explored. An efficient, accurate, and standardized measurement tool is needed. Patients diagnosed with TBAD were consecutively included. Patients with thrombosis in the fourth lumen, aortic rupture, or poor image quality were excluded. And if the true lumen was compressed to a thin line, or patients with abnormal supraarc branch oranges were also excluded. Finally, 139 patients were included. They were randomly divided into training, validation, and testing set to train the model, estimate, and demonstrate the performance of the model. The characteristics of patients and the CTA parameters are listed in the table. The study covered various machines commonly used in clinical practice. We implemented a deep learning algorithm to segment TBADs and measure the diameter. First, all images were denoised with a non-local mean threshold algorithm. Second, a region of interest detection algorithm was used to target the aortic lumen. Considering the huge diversity of data, the CTA images were resampled for normalization regarding the box cell size and value before training. An end-to-end connected three-dimensional net architecture was used for entire aortic segmentation, and intersection over unit tracing was used to identify the true and false lumen. The UNet used a network structure that included downsampling and upsampling processes. The movie shows the automatic segmentation and the reconstruction of the membrane, true, and false lumen. After the segmentation and the reconstruction, centerline analysis and measurement were performed. The case report shows the interface of our software system. This system can automatically segment aortic dissection and identify true and false lumen. The maximum and minimum diameter of the inner aorta, true and false lumen at the specific position are displayed on the left column. In the display interface, the system can facilitate the observation of the aorta from any angle and provide the VR, CPR, and the CMIP images. The VR image can display the true lumen, false lumen, and the dissected membrane in three-dimensional images. To verify the segmentation accuracy of the model, the segmentation results were compared with the ground truth, which was the manual annotation of aortic lumen by an experienced radiologist. The segmentation results of deep learning corresponded well with ground truth. The model worked well in the testing process. Dice coefficient score values were significantly higher than that reported in a previous study. We separated the aorta into the ascending aorta, aortic arc, descending aorta, and the abdominal aorta, and found the DCS was high in each region, while the segmentation performance was comparatively poor in the abdominal aorta. In order to assess the accuracy, we chose 32 parameters, including maximum and minimum diameter. Radiologists with 3 years of experience were invited to measure. We found linear relationships between reference and measurements from these two methods. As the measurement errors, the results with deep learning method were much fewer than that with manual method at all positions in each lumen. In addition, the deep learning model maintained high accuracy at all positions in all lumen, while the performance of the manual method in the true and false lumen was not as good as the interior aorta. From this table, we can see the average deep learning measurement error at each position was fewer than that observed with the manual measurement. The performance for the interior aorta was better than that for the true and false lumen, regardless of the method used, and the differences were greater in the manual method. So the measurements using the deep learning method were more accurate. Black-Altman plots revealed the deviations of the diameters between the reference standard and the manual or deep learning method. The diameters measured with the deep learning method were more consistent with the reference standard. The diameters measured by the manual method were assessed to evaluate reliability. For inter-observer reproducibility, the difference in the interior aorta diameter between the two observers was statistically significant, while there was no difference in the true and false lumen. However, there were no intra- and inter-observer differences in the deep learning method. Last but not least, we compared the measurement time. Deep learning method could be used to measure faster than manual method. There were 3 limitations in the study. First, the training and testing data sets were not large enough due to the low prevalence of TBAD. More data would be helpful to improve the robustness. Second, only TBAD patients were included. Since for type A aortic dissection, replacement of the aorta by an artificial vessel is recommended and is of little importance to measure diameters. Thirdly, TBAD with thrombus in the fourth lumen was not included. We intended to focus on thrombosis segmentation in a subsequent study. To the best of our knowledge, this is the first application of 3-dimension deep learning neural networks in TBAD to measure the vascular diameter, as well as to evaluate the accuracy and the consistency of the model. This model enabled precising and aortic measurements. With more accurate, reliable, and stable measurements, deep learning is likely to play an important role in guiding intervention and assessing aortic remodeling. The proposed deep learning method will reduce the labor of radiologists in the near future. Thanks for your attention.